Well, welcome everybody to our somewhat belated International Overdose Awareness Day event at the Yarra Drug and Health Forum. My name's Peter Wearne. I'm privileged and honoured to chair the Yarra Drug and Health Forum. And more than that, I'm privileged and honoured to know all the people who will be contributing tonight. What a sensational group of human beings we have that are going to share their thoughts about this event and this day. Before I start, I'd like to acknowledge that no matter where we are meeting on stolen Aboriginal land. And the pain and the suffering that theft has caused for generations and generations of First Nations people continues to this day. And we want to acknowledge that pain, but we want to also acknowledge the resilience, the wisdom, the strength and the spirituality of the Aboriginal community and the debt that we have to that community. I'm on stolen Wurundjeri land, people of the Kulin Nation, and I hope you would join in me in wishing that soon, very soon, we will have true reconciliation and true acknowledgement of both the harm and of the amazing gifts that we've been granted by being part of this country and being able to know and be part of Aboriginal community. So I just want to acknowledge that. And I want to especially acknowledge Uncle Colin Hunter, who's a Wurundjeri elder and is a sensational human being. And I want to give a shout out to Uncle Bobby Nichols up in Shepparton in Yorta country. They're doing it tough up there at the moment. And it's a privilege I have to do some work with Uncle Bobby. So today is International Overdose Awareness Day. And I think this is the most important day in my calendar and in our calendar. And I was saying before that there's a summit in Canberra that started today on the horrific impacts of family violence and women's places in workforce, home and community and the harm that is done to women every day through awful acts of violence and discrimination. The stats in Victoria are that about 65 women every year die from family violence. In the whole of Australia, something like over 1,000 people have died from COVID. And yet in the last 12 months in Victoria alone, 585 people died from drug overdoses. That's died from drug overdoses. That's straight out of the last year's coroner's report. And I don't say that to diminish the suffering and pain of people dying from COVID or the impacts of family violence. I say that to get in perspective what we're actually talking about today. We're actually talking about incredible suffering and harm and tragedy. And it's almost a tragedy that because of stigma and shame and the feelings of guilt and embarrassment, families, friends and loved ones rarely feel able to speak about. So it's our privilege today to acknowledge and remember all those that have died recently, all our friends that have died. And I personally would like to say, I'd like to remember Mr. Tony Palmer, a great campaigner for harm reduction in this country, the inventor of mobile needle exchange, who sadly passed away nearly 3.5 years ago. But it's also with great pleasure that I invite Mr. Stevie Thorpe to speak, to be our first speaker. Stevie is a Gunai Gundjamara man, and he is a person that I count as a privilege to know and be a friend of. Stevie has spent many years working in community and working with people in community, in the Aboriginal community, trying to find young people employment, but just being a solid community member, a person that gives of himself. And Stevie has graciously agreed to speak to us tonight. So over to you, Stevie.
Thanks, Peter. Yeah, really glad to be here, and thanks for inviting me on today. Just wanted to share my story, and Peter asked me to come on and just share my story of that resilience and that strength that I've been able to find on my journey but wasn't always there. I've been on some challenging journeys, and it all started off with, I think I want to acknowledge, that I'm a Gunai and Gunditjmara man first of all, and I am too meeting on the lands of the Wurundjeri people, the Kulin Nations. But yeah, I just want to also acknowledge that 12 weeks ago, I became a dad for the first time, and I'm a proud stepfather of a 10-year-old boy and a fiance of a beautiful partner. And I want to acknowledge that because 7 years ago, I couldn't see myself in this position. But not only because of that, it's the best time of my life, to be able to give to the next generation. And I take that into my work too. And today I started a new job at Mullum Mullum Indigenous Gathering Place as a social enterprise coordinator. And I'm really excited about their vision of bringing culture and, being a gathering place for Aboriginal people, because that's what we need. We've been displaced and disconnected. And yeah, so I'm really excited about that. And some of my work that I've done over the last 5-7 years has been about youth. So I worked at Dadi Manwaro, which is a family violence service, focusing on healing as a way of healing the traumas and stuff, and accountability as a way of creating the change. And then I moved on to Charcoal Lane, where they do employment and training opportunities for young Aboriginal people. And I just finished up Friday, and that's going to close. But it's about empowering the next generation. And I feel like I didn't have a lot of that growing up. Moved around, been in out of home care from a very young age, 10 years old, and seeing family violence from it as a young fella. It led me into traumas and drugs. And that's why I'm here today, to share a bit about that story too, because I was 15 years in drug abuse and the addiction cycles, starting off with alcohol and then ending with 4 years on ice. And I had multiple occasions where I had psychosis and overdose and ended up in hospital. I had a heart attack. And I thought I wasn't going to get my life back on track. When you have psychosis and you're thinking that you can read other people's voices, other people's minds, and you're doing that sort of damage to yourself, I was giving up. And that really was a bit of a shift for me, is that I didn't want to die. I didn't want to leave that way. And too many young people and family members I see in the communities and that I'm in, are taking their lives, and it is another devastating and tragic reality that I've seen, and that we're gathering here today to address and to talk about, and hopefully to look at things differently and create solutions. And definitely needs a lot of empathy and care, people that are going through that. And I guess I just wanted to share that. And I'm very thankful for where I am today. But I just hope that my words, for whoever's listening, and I hope that it can inspire or can create some sort of change, that it is possible to heal from drugs, and there is a life after drugs. I think that's the key, and there's a life for people that are experiencing drug abuse too, and we need to show the care and have the services for people that are in those realities. But I just like to say thanks to Peter for inviting me on. You're a good friend, and I'm happy to share my story. That was my identity. So my identity was all around drugs, and I seen that overdose. But creating new identities is very important. be able to recover. And I think that's what that's what I see as my, way out of that, is, you've got an identity as a father, identity as a community member, wanting to give back. Because for me, I was taking, from my family and from myself and from my community. And I want to start, I had to go on a healing journey of 7 years. I've been doing men's groups and, went on initiation, cultural ceremonies. I've done lots of yoga, different things, but we've all got to go on those journeys of healing. And I'm very thankful that I've just come out of that. And if I can inspire people to change, especially the young people, well, that's what I'm committed to. So thanks for hearing me out.
Stevie, thank you. And thanks for just sharing your heart and your soul to us, mate. And you're a brother to a different mother. So good on you, my friend. So I'd like to acknowledge the leadership of John Ryan and his role as the CEO of the Penington Institute. So 21 years ago, Sally Finn in St Kilda, who worked in the harm reduction program at the Salvation Army down there, was so sick to death of people, being forgotten and not acknowledged through the pain and the suffering and some of the deaths that families had to deal with in her work as a needle exchange and harm reduction worker. And it was her idea to start International Overdose Awareness Day. So a shout out to Sally. I'd like to invite John Ryan now to speak. Are you with us, John? There he is. Now, it's also a really special day today for John because it's his birthday today. And he's kindly agreed to speak on his birthday. I had to embarrass you, John. So let me just say a little about John. I met John years and years ago when he was working for the Penington inquiry into illicit drug use in Victoria. That was in the mid-90s. And John was working in the support team that supported the inquirers in that role. Since then, John's major role has been as the CEO of what was Annex and now the Penington Institute. John has a number of international hats on, one of which I think is a president of the International Harm Reduction peak body of the world. So not anymore?
No, it used to be.
Used to be. Oh, well, that's so clearly John is someone that has a long and committed passion to harm reduction and sensible policy. So welcome, John, and we're rapt to have you tonight.
Thanks very much, Peter, and thanks very much to Yarra Drug and Health Forum for organising this event, and acknowledgements to traditional owners, also to the politicians that are with us. I think members of Parliament have a especially difficult role in relation to drug policy issues, partly because of the sort of divisive nature of these conversations. And so I think it's a testament to politicians when they actually follow evidence-based policy. We've heard a lot of evidence-based policy compliance in the last while. I don't think that has yet applied to the drug space, unfortunately. Want to also acknowledge that I've known Danny Jeffcote for quite a while, and I happen to know that it's also his birthday today. So bad luck, Danny, the cat's out of the bag. This is a sort of challenging topic, 5 minutes to talk about overdose from a world perspective. Peter's right, we do convene International Overdose Awareness Day, and it was for that reason since about 2012, I think we've been doing it. That's all a bit of a blur, but maybe 4 years ago or 5 years ago, it sort of struck me that if you don't count it, it doesn't exist, which is why we started doing Australia's annual overdose report. And that's been a really key product of Penington Institute, I think, which is to try and quantify what's going on in what's often a mysterious and stigmatized space, which is the drug space. And especially when you hear stories. I typically hear them from mothers when they talk about their lost child, and how at the funeral it was never acknowledged as an overdose. It was, I've heard from so many mothers who say they preferred to describe it as a suicide, which I've always found to be a most sort of like, why would suicide be nicer than overdose in terms of a cause of death? Other more creative sort of ways of managing it has been, I said my son died of cancer, it was a road accident. These conversations are really difficult, and that's part of what we're really determined to do, which is to have conversations that are honest, basically, and true. And when Peter was talking about some of the stats, our overdose report has actually analysed the leading causes of death for people in their 20s, 30s and 40s in Australia, and overdose is either the second or third leading cause of death for people that are fundamentally in the prime of their life, and they often therefore leave behind their own children, their own brothers and sisters, but most tragically to my mind, because I don't think there's anything worse for a parent to lose their child. Their parents are often alive and attending their funeral. And when you look at the statistics, we heard, I think, a really inspiring contribution from Stevie before, but if you look at the statistics around Aboriginal and Torres Strait Islanders, they're 4 times more likely to die of overdose than the general Australian population. So we've actually got, in my view, a tragedy that's not getting the attention that it deserves. There's certainly been initiatives in various jurisdictions, but I don't think we've got what Norway had, which was a national overdose strategy. And the subtitle of that strategy was, sure, you can quit drugs, but first you have to survive. I think that's really the heart of what we're trying to do, which is A, keep people alive so that B, they can be supported to actually flourish in the community. Overdose Awareness Day is something that is locally driven. So Yarra Drug and Health Forums is an example of an organisation that's doing it because of their commitment, and I really am always moved by that. President Biden proclaimed Overdose Awareness Week last week in the lead up to Overdose Awareness Day, and also included in that Overdose Awareness Day, which was a really big thing for something that started as a barbecue in St Kilda with Finn at the Salvos. The scale of the problem in the States is unimaginable, I think, for us here. 92,000 deaths last year, 600,000 deaths from COVID, 92 from overdose. But to be honest, it's the stories of particularly mums. I think I must have a prejudice to mums, but of people that are personally affected. I myself have been personally affected in family and friends, etc. But it's the tragedy of overdose that doesn't get a big enough Guernsey, I think, in terms of the impact on families. And when you get emails, as we did last week, from people in Myanmar saying, I'm really sorry, we can't run our overdose event this year because of the security situation, which I interpreted to be a reference to the coup earlier this year. Or if you get an apology email from people in Kabul saying we can't run our event because of the security situation, and then you get outreach from people in Kenya and people in, Norway for that matter, you really realise that the global drug situation is so improperly addressed and so really fundamentally out of control. It's sad, but ultimately Overdose Awareness Day has got to be more about prevention. Got to do the remembrance, absolutely, but to my mind, we've got to be doing much more in terms of preventing overdose, saving people's lives, and I think acknowledging the grief that the drug policy failure has created for those individuals that consume drugs, their friends and family. But also, you know, in the Richmond context, I think we've got to acknowledge that in an open drug market, there are people that have got absolutely nothing to do with drugs that experience the very negative consequences, including seeing people die from overdose. So, you know, in a way, it's a tragedy that touches all of us. And the idea that it's just a Richmond problem is not backed up by the evidence. The evidence is that for regional and rural people, they're per capita more likely in Australia to die from overdose than people from the cities. So it is something that touches all of us. And I would, I think our biggest challenge now is not community understanding. I think the community's got much more exposure to these issues and has a much more compassionate approach. I think our failure is fundamentally a policy failure where we're still spending nearly 2/3 of our budget on law enforcement and very, very little on harm reduction or treatment. And that's the challenge. Ultimately, it's a leadership challenge. And I think hopefully with President Biden, with a son who's had a personal experience of drug problems and an American situation where they've been traditionally very averse to evidence-based policy, we might be turning the page. That's my hope. I think we will turn the page because these overdose deaths are unnecessary and there is a growing community of people who want to put an end to it. So thanks very much to Yarra Drug and Health Forum for being part of that movement to have a much better approach to substance use. Thanks.
Really appreciate your words, John, and look forward to hearing from you in future days. But thanks again for what you've had to say. It's now with a lot of pleasure I invite, I think it's the Honourable Fiona Patten, who's the member of the Upper House in the Victorian Parliament for the Northern Metropolitan area of Melbourne. Fiona's credentials in this area of drug policy, drug leadership and advocacy are unquestioned for any Victorian politician in my lifetime. And I don't say that lightly. I say that absolutely sincerely. And it's Fiona never knocks back an opportunity to advocate, and we're so pleased that we could have Fiona live tonight. So welcome, Fiona.
Thank you so much, Peter. And again, thank you to everyone who's here today. You know, Stevie, that was such a great story, and I think so often epitomises why we recognise International Overdose Awareness Day. It's about keeping people alive so that they can go on to have, you know, wonderful lives as you're looking forward to, and to acknowledge that I'm also on Wurundjeri land from the Kulin Nation. And, you know, today I spent the day in a justice inquiry. How do we fix the criminal justice system? And oh my God, you know, what we're doing here today is what we're talking about. You know, this is the effect of our really fucking awful criminal justice system. And as John said, well, he probably didn't say this, but our really fucking awful drug policies. And then listening to, okay, I know you didn't say that, but it's, you know, it's your birthday, so you would only say nice things. But listening to this and thinking about this, on the day that it was International Overdose Awareness Day last week, I was on 3AW talking to Neil Mitchell, and he was rushing me to get me off because he had, you know, Assistant Commissioner Glenn Weir on there to talk about the road toll, to talk about the deaths of the road toll. And, you know, in previous years, you know, that's been my line. I know that's been John's line. I know it's been many of us who've said, you know, the toll of overdoses is double our road toll. And we use that to sort of set a picture for people. But when this year, when John was saying that it's the second leading cause of death for people aged, I think it's the 20 to 29-year-olds, is it, John? I know you can't speak, so I'm just asking you. But when it's the second and third leading cause of death in our community, you know, that's when International Overdose Awareness Day should be something else. You know, I was thinking about how, you know, I've been involved in this area. I've been involved in needle exchanges, involved in this area from the early 90s when I used to attend World AIDS Day. And we would remember the people who died from HIV and AIDS. And we would talk about what we needed to do to change it. And drug law reform was obviously there. But now, on that day where Glenn Weir was there saying, whatever it takes to reduce the road toll, whatever it takes, nothing is off the table when it comes to the road toll, said the Assistant Commissioner. Well, we need to be having that conversation around drug policy. We need to be having that conversation about the 500 people who died in Victoria from a drug overdose. That nothing should be off the table. Now, it turns out like Glenn Weir was also the police representative for the cannabis inquiry. And we were talking about decriminalisation, talking about changing our approach to cannabis laws. And he said, I'm worried about that. I think legalising cannabis would increase the road toll. Now, that's a quote. So here we have a person who, whatever it takes to address the road toll, refuses to look at drug law reform as a way of addressing the deaths that we are all mourning, that we never forget that person in our lives who is no longer with us, that preventable death. And we think about those lives of what they could be. And, you know, I agree with John. This is about policy. This is about, well, sadly, it's divisive, and it bloody well should not be divisive. What can we do to stop overdoses being the second and third leading cause of death for cohorts in our community? What can we do to stop overdose deaths doubling the number of people who died on our roads? Well, there's a lot of things we can do. And there's a lot of things that we have to do because we have to change the stigma. We have to change the stigma. And, you know, I'm seeing people in my screen that, you know, I know the stigma and I know what they had to deal with when they talked about loved ones who died. And as John talked about, the parents that had to bury their children, the parents that were actually too scared to say how their child died. In fact, the sisters, the brothers, the daughters who also didn't want to talk about this. We have to change the stigma. We have to accept that this is not someone's fault. And, you know, we talk about North Richmond and, I get on Twitter, just get rid of the druggies, just say no. Like people are still saying in 2021, just say no. You know, and then I try and point out that most of those deaths were actually accidental overdose from prescription drugs. That it was a benzodiazepine mixed with an opioid or mixed with alcohol that was the cause of their death. And they go silent. But I am an advocate here, and I do want to keep campaigning for it. I think we're getting there. I mean, well, Jesus, when POTUS puts out something to say that it's over, not only International Overdose Awareness Day, it's International Overdose Awareness Week. We have made progress, and we need to make that progress in our own state. And I know that everyone who's watching today and everyone who's part of it today, you are championing this and you are making a difference. Each and every one of the people who's I can see on my screen now have been saving lives, have been changing the conversation. But There's a lot more we can do, and nothing should be off the table to change this. And certainly I'm committed to it. I know that there's other politicians who are committed to it. And now it's just that we have to keep talking about this. We have to be brave and talk about it. We have to be brave and talk. We have to sometimes come out of the closet, but we have to talk about drug use, because that's the only way we're going to stop people from dying from it. Thank you.
As usual, Fiona, if you ever have more of you in Parliament, I think the Parliament would be better for it. But I do want to thank you again for your not only your wisdom, but your passion. And remember that it was Fiona that helped organise a parliamentary special persons tour of overseas injecting facilities and drug policy settings. And I look forward to the day when where heroin and other drugs are not illegal in this state and people don't have to die unnecessarily. So thanks, Fiona. Thank you very much. We're about to see a pre-recorded presentation from David Limbrick from the Lib Democrats, who's also a member of the upper house in the Victorian Parliament. He's in the southern region of Melbourne. I think his epicentre is Chelsea or somewhere like that. And so I'll throw to Nick Wallace to show that presentation from David. And we thank David because he also is a crossbencher that has been highly committed to liberal, sort of open-minded law reform in a number of areas, drug policy being one of them. Thanks, Nick.
Hi, my name is David Limbrick. I'm the Victorian Member of Parliament for the South Eastern Metropolitan region. Overdose Awareness Day started right here in Melbourne and is now marked by events all around the world, from candlelight vigils to remember those who we have lost, to policy discussions and workshops on overdose prevention. Having an event to create awareness about the risks of overdose is important, as it's frequently something that happens in the shadows. As a society, we frequently respond to drug use with shame and stigma in our policies and in our discourse. But each and every life was valuable, and those people have left behind those who loved and cared for them. And many of these deaths are preventable by changing our policies and changing the way that we talk about drug use. The Victorian Coroner's Report, released in July this year, shows that hundreds of lives are lost each year to overdose. It also shows that the trend over the last decade is that pharmaceutical drugs are the biggest contributor to overdose deaths. For many people in the community, this might be a surprise. Drug use is something that happens to someone else, something that other people do. Overdoses mean people using heroin in the street, but this isn't where most drug use happens, and it's not where most overdoses actually occur. If we start from a place of honesty, we would have to admit that in some way we all use drugs, and did not inhale at university kind, but our morning coffees, our evening whiskey, the drugs we buy from our pharmacy, and yes, also illicit drugs. Which drugs are illegal has more to do with history and politics than science and morality. I'm a member of Parliament, and on many issues I find myself on the opposite side of the issues to the government. But on issues related to drug policy, when the government has moved forward, I've been happy to support them, often urging them to go further and do more. Politics doesn't hold all of the answers, but there's certainly laws and policies that could change to improve people's lives and reduce the risk of overdose. What politics can't do, the community can and will, often leading politicians to the solutions. I'd like to thank the Yarra Drug and Health Forum for inviting me to speak and for the work they do in the community. I would also like to thank Harm Reduction Victoria, who work at the front lines of overdose prevention. We would never know how many lives have been saved by their staff and volunteers, work that has been particularly challenging during the pandemic. Finally, I would like to thank the family members who have come forward over recent years to share their stories so that we can better understand the impact on overdose, put compassion at the forefront of our thinking, and embrace solutions to avoid more tragedies in the future. Thank you very much.
So really appreciate the advocacy and the support that David Limbrick has shown in his time in Parliament for this cause, and really want to acknowledge the work of advocacy that he does around the liberalisation around sensible evidence-based drug policy. It's with great pleasure now I invite Debbie Wearne from APOD. I met Debbie many, many years ago, and Debbie is a mental health professional. She is a parent. She's the founder or co-founder of APOD. She's worked in advocacy and directly supporting dozens and dozens and dozens of families every week that are going through a cycle of addiction. Debbie's one of the most impressive human beings I've ever met in my life. And we were really rapt that Debbie could come on tonight and just share her own thoughts around International Overdose Awareness Day. So over to you, Debbie.
Thank you, Peter. Yeah, it's a day where we do remember all those that have lost their lives from overdose, and as everybody who has spoken before me, many of them are accidental overdoses. You know, the majority, and it's so sad because those people leave behind their families and friends, and it's just so changed that everybody's lives have changed so much. So I have 5 adult children, but 2 of them have had a problem with drugs over their time. And my first son, who was using opiates, what I noticed when I first started was that it was just so confusing for me because I didn't know anything about drug use. And, you know, he did recognise that he did have an issue, but he didn't really know how to deal with it. And neither did I as a parent. And what I noticed when I went to get some help was that the lack of common sense and the confusion, because because I had people telling me that it was best that, you know, he'd have to hit rock bottom, he'd have to work this out himself and be tough and all these really weird things that went completely against, you know, if he had cancer or if he had a broken leg. So in the end, what I did was I recognised that to put some common sense into it was that he'd work it out in his time, but during his journey with using drugs, that I just needed to support him and make sure that if he was injecting, that he did have clean needles and clean equipment, and if he was using, you know, to make sure he was using with somebody else, or if he was using at home, to leave the door open so that we knew to check. Because, and then the other thing I really noticed it was a 10-year period, I noticed was that why wouldn't he just be able to go and get some heroin or some opiates in the morning, in the evening, just prescribe them? Wouldn't that be better for the whole community and for him, and so that he could get on with work rather than have to continually chase drugs around? And his life became really chaotic because there was no common sense around the help that was out there for him. And he, you know, after about 10 years, he did stop using, and he got, you know, he was able to get back into his life. But I ask him now, and he always says it's because you guys were just so supportive and so calm and so caring, and you didn't really jump up and down about it, and you supported me all the way through it. And, you know, that was 10 years ago now. And back then I remember going to the doctor and saying, can you get me some naloxone? And back when it wasn't even available, and the doctor hunted it down for me, because I said, you know, it just makes sense that if he does overdose, an ambulance would take a long time, whereas I'm there, or his friend's there, or so that's just what I noticed during that period, just the lack of the lack of common sense and the confusion that happens for families. And our organisation has 7 support groups that run over a fortnight, and every single one of those groups has lost a family member to overdose. You know, like every single group, it's just, and, you know, and when someone passes, it's like the whole group has lost someone in their family, because our groups become so close and so supportive of each other. You know, it's families and friends of people that are, you know, that are using different substances. And, you know, it's just so sad because all of them were accidental and all of them were preventable. and it just doesn't even make any sense. I've got another son who's still currently using different drugs where he can overdose, and I've had to revive him a few times. But how incredible is it that he's still alive? Because he's got an amazing family around him that can support him and not judge him at all. Like when Peter and John talked about funerals, it is awful. When I've been to so many funerals now where people have died from overdose, and it is so awful for the families because they can't even share normally how the person has passed because of the shame and stigma. And so it is really so important that we can get the message out there and jump into conversations where people are talking not from understanding, from the shame and stigma side rather than from, the caring and common sense ground. That, if we all took that as a community, then we would have so fewer deaths, and also people can move on with their lives so much quicker if it's not secretive and it's not seen as a problem. Our son that's using at the moment, he has the most amazingly supportive siblings, and it's the drug use and the overdoses that happen at different times it's just part of where he is at the moment. But he will move on in his life. And the beauty of our other son that used was when he did move on with his life, his self-esteem was intact. So he was able to move on very quickly and set up his own company and employ other young people that have got problems now. But he couldn't have done that if his self-esteem had been worn into the ground during that period. So yeah, just another remembering those who have lost their lives, and just how sad it is for me to see those families lose their loved ones. Thank you.
Thanks, Deb. I think we should also understand that Deb's position is amazing because she helped found this amazing organisation that doesn't get any government funding at all, that is supporting dozens and dozens and dozens of families in dealing with addiction, in dealing with grief and loss around drug issues. And Victoria's lucky to have you, Debbie. Victoria is lucky to have you. It's with great pleasure that I turn to someone else that wears their superhero outfit underneath their skin, and that's Cherie Short. And Cherie is a person I've had a great privilege of meeting. Cherie is a parent, a mother, a worker, an educator, an advocate, and again, one of the most impressive human beings you'll ever meet. And Cherie is currently working and helping with APOD, but also is working within drug treatment services, delivering support to people going through withdrawal, and also educating people on overdose prevention. And I welcome you, Cherie, to the microphone, and it's fantastic that you're here tonight.
Thank you, Peter. Good evening, everyone. I'd like to begin by acknowledging the traditional owners of the land on which we're meeting. I pay my respects to their elders, past, present, and emerging. So I'm from APOD Family Support, and this evening I'll be speaking to you as a grieving mother who is missing her son dearly. For 6 years now, the 25th of August has marked a very unwanted anniversary for my family, one that no parent ever wants on their calendar. Like most of Australia's drug-related deaths, Aaron's tragic death was accidental, and he will forever remain 26 years young. Recently, I was asked what International Overdose Awareness Day meant to me, and I remembered those that had passed from an overdose. But immediately, my thoughts went to the profound grief and the suffering that are felt by the families and friends of loved ones left behind, because losing a loved one to a drug overdose can be an extremely complicated and lifelong grief. It's a stigmatized death in our society where stigma is still alive and well. Grief is an extremely difficult emotion to navigate alone. It can be crippling without the added element of stigma. A common theme that comes up for families like ours is a high level of guilt, remorse, self-blame, and regret, feeling like we've failed our children. And no matter what anyone says, this will never leave us. I will forever harbour a deep sadness that I couldn't keep my son alive. Aaron's story has a common theme, an addiction starting with pain medication. He was nearly 18 when an accident requiring surgery saw endone introduced into his life. One prescription and his addiction was born. Sadly, we were unaware at this time that Aaron's addiction was masking the significant childhood trauma he had experienced. Quickly, he found the opiates helped to fill the deep void he was feeling within, and the void he had hollowed out by self-hatred. From there, it wasn't long before he discovered the terrible consequences of a heroin addiction, referring to it as a devil's drug, and realizing his addiction was no longer a choice and that his body and mind was depending on more to survive. Soon enough, he couldn't even recognize his old life. His self-medicating had socially outcast him. His friends and his hobbies slowly dropped off. He isolated, and his deficiencies deteriorated into dangerous self-loathing. Initially, and for years, we frantically tried to push him into recovery. We were in immense fear of losing him. We were so desperate for a service to take him. Just please fix him. Please fix him so he can lead the meaningful life he deserves to live. God, we were so naive. Services weren't readily accessible, and there were always limitations on the treatment they could provide. I remember saying in our first contact, "What do you mean we have to wait 8 weeks for a detox bed? Our child's sick, he's at risk of dying." So as parents, we thought we'd be able to turn this around, right? We were going to fix it all up quickly without anyone knowing or realising it was going on, hide it from our friends, hide it from our family. Whereas parents, there's no reason why we can't get this under control. And there lies the myth that addiction can be cleaned up quickly. We felt immense failure as parents and became a family who were trying to hide addiction behind fear, behind guilt and shame, all because of stigma. The same stigma profoundly hindered Aaron's ability to live a meaningful life. The stigma that was a barrier to us seeking support for both Aaron and our family. The fear we had as parents wreaked havoc on our lives. We affected our minds and bodies, relationships were strained. We were isolated from family and friends, not wanting them to know what was going on. Even when he passed, they were so shocked at what had actually happened. Only a couple of close family members knew, and this went on for years. So this is how fiercely we fought to protect him. I endlessly prayed for the universe to make things right for him again, and our tears were many, but I know his were far greater. Parents already experience a high level of guilt, remorse, and self-blame, and stigma has people hiding behind shame, reducing the prospect of positive outcomes. Our experience of stigma came from different places in the community, and it was disappointing that it even came from some health professionals. Sadly, we still feel burdened by it. The next 8 years would see Aaron out of detoxes countless times and for long stays at rehabs. The first few times being enforced by us, the many times thereafter were of its own accord. He fought back fiercely for sobriety, but his trauma would continue to set him back. Looking back, I shake my head and wonder how he did it. Time and time again, he booked himself into detoxes, rehabs, trauma counselling. I can only imagine how much courage and strength it took to fight his addiction, not to mention the determination it required to navigate the system and the services and experience limitations. You're a warrior when you have the bravery to face who you are without fear, embarrassment or denial, just like our son did. In the face of adversity, he fought like hell. He fought for sobriety. Anyway, his perseverance eventually paid off, and it gave him a reprieve of over a year in recovery. It was a beautiful time for us, one we'll forever be grateful for. Healing had begun, and we could all feel the sunshine on our face again. And, he had passion with his experience, to use his experience to help others. He started studying and giving back to the community. And then when our guard was let down and least expected, never in a million years did we expect the real nightmare was yet to come. When we lost him, it made any of our experiences feel like a walk in the park. I was silent for so long, hiding our family secret, fiercely wanting to protect our son and ourselves from the thick stigma that still exists. It was such a lonely, dark, desperate time for all of us, and my decision now to speak out is through the ultimate love and respect I have for Aaron. Talking about overdose can help save a life. I recently had the opportunity to deliver some naloxone training, and they were surprised to know that every day we lose people in Victoria to overdose. Overdose is a hidden crisis. You know, we're losing people. The numbers just keep increasing. And I cringe to think our dear son and the children of my lovely friends are included in those figures. Stories of our children and loved ones should not be saved for International Overdose Awareness Day. The impact of overdose is profound and long-lasting. We need to end the stigma and prevent the deaths that affect our communities. If you read the latest Penington annual overdose report, you'd be aware that yet again deaths from overdose outnumber the road toll. In response to the road toll deaths, Australia has developed a national road safety strategy. They fund education and awareness campaigns and have even established an office. Yet an epidemic of overdoses continues to claim thousands of Australian lives in virtual silence. Precious lives like our son's. My son's life need not be in vain, and more loved ones' lives need not be lost. We need urgently a national prevention strategy. The overdose report has actually communicated this for the past 2 years. Families like mine deserve one. Whilst we drag our feet, more precious lives are lost. So this is an urgent health issue, and more than ever in this current environment, we need change and solutions. It deserves the attention, the silent crisis deserves the attention of every premier, every minister. It deserves the same respect as the National Road Safety Strategy. How can we be determining whose life is important? All lives are precious. It was a recommendation last year, so why do we keep sifting through the same old ashes? We know the current strategies are failing and the war on drugs is never going to work. So let's start working through the policies and the barriers that prevent a person to get the help they need. Let's enhance what's already working. There's some great work happening out there. Since I've been in the sector, there's some great stuff happening. We're doing it too slowly though. I mean, we've got to connect it all up and enhance our systems to allow people to get the help that they need. And it's not a wish list, it's achievable. So we need to ask people, what sort of experiences are they having in a drug treatment system in Australia? Start asking questions. What are some of the policies that may have inadvertently prevented them from getting the help they needed? You know, have they overdosed several times before the health system took notice of them? You know, did they actually receive a law and order response instead of a health response? I'm advocating for my son and will forever have my heart hooked into this. Aaron taught me that it's up to each of us to look into our hearts beyond superficial thoughts and just see what is truly real. He was, in his advocacy, he was passionate about helping others. He was always trying to open the doors for vulnerable people. And his belief was that a person should get as many chances as they need, because while there's a life, there's still hope. Anyone that takes an interest in this knows that Australia has a national health crisis and more families need not lose their loved ones to overdose. It's a preventable death and it's affecting our communities. And I keep preaching to the converted, and we need to actually get this message out to people, educate people about overdose. You know, we have the power to influence change, change mindsets, change systems, change policies for a more humane approach. Anyway, on that note, I'd like to thank the Yarra Drug and Health Fund for giving families like mine a voice and for continuing this important discussion. Thanks, Peter.
Oh, no, thanks to you, Debbie, Cherie and Debbie. And Cherie, yeah, I think that we need to, like you say, we need to raise these issues and we need an overall plan rather than just sentiment. And I know you've talked about that a lot. We don't need people's sympathy, we need people's action. So respect and love to you. It's with great pleasure now that I throw to a good friend of mine. I hope he's okay with that. Mr. Mukhtar Mohammed. And I've known Mukhtar for, it's a long time now, Mukhtar. I think I was younger and you were, well, you've always been good looking. But Mukhtar is a man of many talents. One of his major talents is his amazing compassion and concern for his community. And Mukhtar's worked with the Islamic Council for a few years now in a post-prison release program, support program. But I met Mukhtar when he was trying to provide an innovation within the Islamic community around peer education for people that were having trouble with drugs. And I'm just rapt that Mukhtar could be here tonight to just share an insight into the impact of Overdose Awareness Day and the impact of overdose on his community and his thoughts about that. So welcome to you, Mukhtar.
Thank you, Peter. And can you hear me? Yeah. Thank you, Peter. You've been more than a friend. You've been like a brother. You've been like a guide for almost a decade now, and I really appreciate all your support for all that time, for me personally and for my community. And to Cherie and Debbie, sorry to hear about your loss. I speak as someone that works with families who have young men and women stuck in the cycle of drug use, and some of these young men and women have unfortunately left our world and died of overdose. And the most recent one I found out about 2 months ago. It's a young man that I've worked with for almost 7 years. And until, I got told about it 2 months ago, sorry. But I found out that it was definitely an overdose, and that he passed away only about 2 weeks ago, because it was difficult to approach the family to find out if he passed away or where he was buried, because, you know, some of the things that you shared around stigma, shame, that's shared by, you know, all cultures, and it's affecting every community in this country. And this young man was so bright. He was always very happy, regardless of, you know, his situation, or at least he displayed happiness. I think inside he had many battles to fight, and I was, you know, beside him for some of that time. And the first time that I actually spoke to this man was in one of the prisons. And even though I've known him for longer than 15 years, we grew up around the same area. We never spoke before. He knew who I was, I knew who he was. But in prison, we connected, and when he came out, he called me, and we hung out that day that he came out. And just the usual thing that we do in my line of work, first day shopping, buying a phone, buying clothes, trying to sort out accommodation. And he was very, very happy at the end of that day. He ended up in a nice hotel. And before I left, he told me that, you know, he never had such treatment before. And I was very happy to know that I was able to make a difference in this person's life. And we saw each other in prison and in community after that. He found it difficult to engage, not because he didn't want to. He always wanted to, and I believed him, and I believe every single one of them when they say, "I want to stop." You know, it's this is the end of the road for me. I want to do something about it, but it's just difficult. It's difficult, and we see it firsthand because it's difficult to get ID. It's very complicated. Without ID, you can't get anywhere, especially if you don't have any photo ID. That's one of the biggest problems that the government needs to look into for people that are homeless and people that come out of prison. They can't establish who they are, so they're almost non-existent in our society. And the last time I saw him was last year in Ramadan. He called me after many years of not seeing him or speaking to him, told me that he needed a phone, he needed clothing, he needed to reestablish himself and that he was serious. And I told him, I know that you're always serious. He came and saw me. We went out shopping. And I called my family before he came and told them that I was breaking my fast outside of someone else. And we spent that day together. We went to Big W, we went to Puma, we bought some stuff, and he was satisfied, he was happy, and we promised each other that we were gonna see each other a bit more. And he did see me again the day after. We hung out, and that day I actually was defrauded, and I found out some money was taken out of my bank account, and I wasn't feeling too well, not knowing who did that, who has my details, my family address. And he comforted me. He understood exactly what I was going through, and he made me feel good and told me that it's most likely a random, and made me feel safe. And after that, we spoke a couple of times. We, called a few landlords on Gumtree to try and get him a place to live. We got some inspections booked, and on the day of the inspection, I called him. He never answered. I'm not sure whether he went to the inspection or not. And 2 months ago, another man who was stuck in the same cycle, who was a friend of his, they shared a cell at one of the prisons, told me that this young man died of overdose. And it was a shock to me because I expected him to be the last person to go through this, because he never looked like he was on drugs most of the time. He looked really good. He spoke very well. He concealed it very well. And he just did not let himself slip too far. And it was difficult to believe. And then I shared that news with another young man that I'm working with currently, who was a childhood friend of this individual. And that young man broke in tears in front of me. And we didn't know how to find out whether it was a definite or not. We thought about contacting the family, but then we knew that in our culture, as in many other cultures, like we've heard the story of Debbie and Cherie, people don't like to talk about this sort of stuff. And the silence is what really conceals, the size of this problem in society. And it's a shame that, some of the young men in all communities, and our community as well, don't know some of these stories, because it makes it feel like it's something so distant, something so far away that it can't happen to me. It has never happened to anyone that I know. But little do they know that some deaths in our community have been because of drug overdose. And but because families don't want to speak about it, and that's for cultural reasons. And before hearing stories from Cherie and Debbie, I thought that this was exclusively a thing in our community. And now I know that it's not just us, it's all of society. And something has to be done about this, because especially now in this pandemic, I've been talking to counsellors that work with some of the men that I work with and the women, and they tell me that they're busy. People are home, they don't have much to do. There's uncertainty, there's fear, and that triggers mental health, and even people that were doing well before can revert back to drug taking, because that's the only escape that some people know. And I fear that in the coming month or even years, we'll see the impact of this time period. And so we all have to work and do our best to bring about change in this space. to talk to the government to see if anything can be done, and a lot can be done actually, if people are willing to listen. And so with that, I conclude what I wanted to say. Thank you so much for giving me the opportunity to share this.
Thank you, Mukhtar. We are so privileged to have people like you in our community, and I know my life is richer for knowing you, and I'm sure that you are going to change attitudes and change behaviours in your community, just the awareness that you raise. So peace be to you, my brother, and thank you for being available tonight.
Thank you, Peter. Peace with you and everyone else. Thank you so much.
We're going to now see a video presentation from the CEO of VAADA, the Victorian Alcohol and Other Drug Association of Victoria, and Mr. Sam Biondo. Sam's been a friend of mine for more than 4 decades, and he's been a community advocate around social justice, and in his current role as CEO of VAADA for more than 13, 14 years, I think, Sam has been a driver of sensible drug law and drug law reform and drug policy. And we're rapt that Sam could be with us tonight, even if it is by video. He felt a bit anxious about speaking publicly, preferred to record it. So I'll get Nick to play Sam's video presentation.
Well, good evening. Before I begin, I'd like to acknowledge the traditional owners of the land we're on and pay my respect to our elders, past and present. And just by way of introduction, I'd also like to acknowledge the work of Bernadette Birchall, Peter Wearne and others involved with the Yarra Drug and Health Forum, who have played such a leading role in acknowledging this special day, not only today, but for many years. I also acknowledge the collective effort of the Forum in advocating for necessary change to our policy and social landscape, and in the process, saving many people's lives. So thank you. Over the years, International Overdose Awareness Day is a timely reminder of what needs to be done. It gives us a time to contemplate, a time to think. It reminds us of the difficulty in shifting the hearts and minds of decision makers to do these things and the subsequent preventable loss of life, what needs to be done. It's for these reasons that I come to the International Overdose Awareness Day with a level of trepidation and contemplating the policy failures, broken families, on the back of bad policy and fragmented systems. Today is a timely reminder of both the failures of government and perseverance of many of us here tonight with enduring passion to make things better for others. It's a beacon for many, galvanising good people to do good things. It's a day where the efforts of those who seek positive change are celebrated and the strength of families who have lost loved ones is commemorated. I've been Executive Officer at VAADA now for 14 years and spoken with many families over that time, and these families know pain. Some have relayed the bittersweet acknowledgement that while celebrating initiatives such as the MSIR, had government implemented it earlier, their child may still have been alive. It's a difficult thing to countenance, that the real life and death implications of political game playing, which is a constant mainstay in APOD policy, and it goes on and on and on. In Victoria, according to coronial figures, we had 4,500 fatal overdoses in the past decade. From 342 deaths in 2010 to 526 in 2020. Policymakers seem impervious to these trends and changes. They forget or grow complacent to the huge pharmaceutical death toll in 2020, where 75% of deaths involved pharmaceuticals. They perhaps assume that Safe Script has dealt with these problems, and at this stage it simply hasn't. Government hasn't been forthcoming with any information that can give us any of these assurances. They loudly celebrate the program, but drown out legitimate questions. Alcohol-related harms are largely ignored. Advocacy is muffled by a deluge of alcohol advertising. And ironically, that is also recognised as an essential. Alcohol is recognised as an essential item during the COVID period. That alcohol contributes to 154 deaths in 2020 during the pandemic is also forgotten. The status quo benefits greatly from stigma, which continues to silence families and people who use drugs from speaking out. This simply deters help seeking from those that could otherwise engage. Stigma and its perpetuation across the media and other populist narratives remains a killer. Just think of the war against supervised injecting facilities and how an inaccurate, harmful narrative of small business owners versus people who use drugs has been allowed to grow in recent times. This approach harms everybody. It maintains the status quo in the CBD of Melbourne, where we have 1 death a month and continuing public drug use. It prevents local business residents from enjoying the long-term benefits of ensuring that people are healthier and have access to support. But this sort of stigma does sell newspapers, sells news, even though it kills people. My frustration with this is totally immense. But there are wins I think we need to contemplate also. At this stage, the government continues to persevere with additional supervised injecting capacity. The Coroner's Court has made more and more positive recommendations aligned with harm reduction, and I suspect will continue to do so. We continue to see more widespread application of naloxone and look with some hope to changes which may occur following the cannabis inquiry and what this might mean for broader debates of drug-related harm. While the work is far from done, the families, peers and people who use drugs, along with those that are trying to effect positive change, deserve great commendation for their tireless work. I thank you for your work. I thank the Yarra Drug and Health Forum, and I thank all those involved. And thank you very much for listening and for the opportunity to speak.
So thanks for those words, Sam. And the one thing I know about Sam Biondo is that he's a man that has a desire and love for community and for social justice and for equity and fairness. So thanks for those words, Sam. It's a great pleasure that I introduce to you Ms. Chloe Spann. Now, Chloe is the Victorian project, one of the Victorian project workers for Family Drug Support Australia, which is a fantastic organisation that was started by Tony Trimmingham and his wife many, many years ago as a result of the death of their son to an overdose in Sydney. And Chloe and her colleagues spend time running support groups and education and information and training for families impacted on and individuals impacted on by drugs and drug dependency. And I've got to tell you that this is so great that we've got Chloe with us tonight, because she is one person that lives the talk and walks the walk. So welcome, Chloe.
Hey, Peter, thank you so much for that. You can all hear me okay, right? Yeah, great, fantastic. Well, thank you so much for having me. And it's a real pleasure to be here today for a number of reasons. And firstly, I'd just like to say that and thank, of course, the Yarra Drug and Health Forum for having me and for the opportunity to speak. And I must say that even as a young university student, I still remember the Yarra Drug and Health Forum as a place that was always forwarding and promoting these sorts of discussions that are going to benefit all of us around drug use and use in society and etc. And I think that in terms of what we've heard already tonight, another point that was said earlier too, which was by Cherie, is that when we talk about overdose, we're talking about a hidden crisis. And frankly, from what we've already heard from pretty much all of our speakers so far, you know, overdose deaths should be and are actually a national crisis. And we really need to be lobbying and talking about that and these sorts of things, even if we're not used to hearing it in the everyday, in our media, in our debates, because that's literally what we're talking about. Statistics of drug-related deaths outweigh a lot of other social issues. We've already talked about domestic violence tonight. We've already talked about the road toll and drug-related deaths, including accidental overdose, including fatal overdoses, you know, is something that's real and it affects all of us. So I just really wanted to make that point before moving on. So thank you. All right. So I would like to just quickly start by acknowledging the traditional owners, the traditional custodians of the land that I'm on today. And I think we've mentioned that's the stolen land of the Wurundjeri people of the Kulin Nation, and would like to pay respects to elders past, present and emerging. Sovereignty was never ceded in Australia, and it always was, and it always will be Aboriginal land. So just to begin, it is an honour and a privilege to share this space alongside so many impressive family members tonight. It takes a lot of courage and strength to stand up and talk about, you know, some life-changing experiences that have happened to themselves personally and their entire family, that, you know, what we're really talking about here is preventable tragedies. You know, they never should have happened, because we know how to do this differently. We know how to do this better. I'd also just like to recognise many of the family members who have decided and chosen to be here today, and for the valuable work that they do in choosing to support and advocate and lobby for their sons, daughters, partners, grandchildren, parents, and of course, friends. We've heard a lot about that too today, that are struggling with a substance use issue. So as many of you know, Family Drug Support is a non-for-profit charity. We support families affected by substance use. We provide a national support line. We run support groups. We've got a flagship program and face-to-face and online delivery methods. But as Peter was talking about before, our organisation actually started exactly out of the circumstances that have brought us here today. And Tony lost his son in 1997 from a heroin overdose. His son died 3 blocks away from where there is an injecting centre now in Sydney. And if that injecting centre was there where after, at the time that Damien was using, perhaps he'd still be alive today. And I'd also just like to note that this particular year is a bit of an odd one for Family Drug Support and for Tony in particular, in that Damien was 23 years old when he died, and it's now been 23 years since his passing. So he's actually, in some sense, he's been dead longer than he's been alive. So I'd also just like to say that much of the work that that Tony pioneered, especially back in the late 90s, has also been picked up by many other family organisations, and we're lucky in Victoria because we do have a more diverse sector of family services in this space now, and we've heard from them today. We've heard from APOD Family Support. We've also got Family Drug Help in Victoria, which is really, really terrific. Basically, giving families access to more empathetic service provision programs, and basically supporting and acknowledging the important role that they play in bringing about better outcomes. And if there's anything that we've learnt over the last 22 years of doing family support at FDS, at this organisation, it's that when families are connected and when they're engaged, they bring about much better circumstances and success for everybody involved. And I think Debbie before was talking about one of her sons And, if it wasn't for a lot of the continued support and belief and hope that she provided to him, that's one of the reasons, that's what brought about his recovery too. That's her recovery as well as his recovery. So I think that, yes, it's something that is for everyone. Someone who uses substances, it's a benefit to them and the entire family system, and arguably for the rest of the community is setting an example of what good looks like. As an organisation, FDS doesn't condemn or condone substance use. It's a model that is informed by evidence about what works and doesn't work. However, I suppose for myself, one thing that is really important to me as a worker is that while we talk about abstinence as best form of harm reduction, we also sit with that reality that it's unrealistic to expect someone with a dependency to just say no or to immediately cease their use. So we believe that everybody deserves universal access to healthcare, regardless of their substance use preference. And this includes tailored initiatives, including pill testing, including drug checking services, including injecting centres, and of course, immediate access to overdose prevention too. I've just got to say quickly that, the experience that, we hear about when we're running support groups and stuff for families is often one clouded by fear. Lots and lots of fear, lots of living grief around trying to support somebody who's there, but many families miss, they're mourning the loss of someone who they felt they once knew. And this event that we're having today is about bereavement and it's about grief, except for many families, there's no cultural validation around their grief. And we've heard that through John Ryan when he was talking about, people not acknowledging the real cause of death at people's funerals. And that just goes to speak to a lot of what we've already heard tonight when it comes to talking about stigma and discrimination. And the reality is that there is, there is a shroud of secrecy that, that cloaks that is around families, that is around people who use drugs. And those repercussions and those realities and the results of that are also, incredibly punitive and futile. And we all deserve a lot better than that, frankly. So it's our belief that Australian families deserve a lot better and really need to be championed for the work that they do in keeping important members of our community alive. It's very common in our support groups that we hear of families basically implementing default harm reduction programs 24 hours a day in their own home to keep their family member alive. And yet there's no acknowledgement of that. There's no rewarding or championing of that. And I think that that's a real shame. Yes. So look, I think, again, I couldn't agree more that there needs to be a broader conversation about drug overdose deaths. It is a national crisis and we need to do something. And I think the Yarra Drug and Health Forum, in making sure that we continue to have events like this that give a voice to people who are largely and the most disproportionately affected by these fucking awful drug policies. I couldn't help but say it. I had to throw that in there. Is just, an invaluable contribution. So thank you so much for having me.
Oh, thanks, Chloe. And, shout out to all the work that FDS does around Australia, and to you personally, really appreciate your efforts and work.
Decades of expensive prohibition and policing haven't reduced the harms associated with drug use. Policies focused on reducing harm and understanding people's complex needs have produced far more positive results. A compassionate approach means understanding complex problems and appropriately resourcing responses that actually work. International Overdose Awareness Day is a global event aiming to raise the awareness of overdose and reduce the stigma of drug-related death. In honour of loved ones lost and dearly missed, today we aim to raise awareness and reduce stigma within our communities around this significant health issue.
Fantastic piece of work done by Harm Reduction Victoria, and we'll be hearing from Stephanie from Harm Reduction Victoria later on. It's with great pleasure that I introduce now and welcome Dr. Nico Clark. I've known Nico for a long time because I've known Nico for a long time, and Nico is he's a special person. He's probably one of the most esteemed and well-recognised expert on addiction medicine in Australia. He's the medical director of the first medically supervised injecting room at North Richmond, so the first one in Victoria. He's also an addiction medicine specialist working at the Royal Melbourne Hospital, and he's also the president of the chapter of addiction medicine in Australia. But not only that, he's a fantastic human being, full of compassion, empathy, understanding and wisdom, and somewhat a degree of great medical skill in the area of addiction medicine. So we're rapt to have Nico here, and we want to acknowledge the life-saving work that the injecting room in North Richmond does in saving dozens and dozens of people's lives since it's been open. So welcome, Nico.
Thank you, Peter. It's a pleasure to be here to join this recognition of International Overdose Awareness Day. Fantastic to hear so many of the speakers today share their own experiences and reflections on this situation. And I'd like to share a little bit about our experience at the medically supervised injecting room over the last few years on this topic as well. First, I'd like to acknowledge that I'm speaking to you from the lands of the Wurundjeri people of the Kulin Nations, pay respects to their elders, past and present, and say what a pleasure it has been for me to get to know many of those Indigenous peoples in North Richmond as they're part of that community, those that have used the facility and those that haven't. I mean, the first thing I'd like to say is that just to kind of provide an update on the number of overdose deaths. It's like 4,500 overdose, non-deaths, sorry, 4,500 overdoses in the injecting room that we've had now since it's been open just over 3 years ago. And it's, sometimes the kind of the magnitude of those numbers really just is kind of difficult to make sense of it. But what kind of stands out to me, having seen a number of those, is just how quiet they are. There's just how quickly and quietly life can slip away if nobody's there to do anything about it. There's no. If we talk about the comparison with overdose, with car accidents and car deaths, there's no loud bang. There's no kind of fanfare. There's just somebody's kind of living and breathing one moment, and then the next they're not breathing. And if we don't do something about that, it can have catastrophic outcomes. I mean, one of the things that you think about is what would happen if we weren't there. There's so many. What would have happened to these 4,500? Many of them were the same people, but what would have happened to these people had they not had the opportunity to inject in a space where there are people there to revive them and hear their stories. One of the things that's kind of really struck me from my involvement in this project in the last few years is the chance to hear so many people's stories. And while people use substances for all kinds of reasons, the overwhelming story that we hear in the injecting room is one of trauma, really, really, really horrendous traumas. It's difficult to fathom, I think, the number of people in our community who really experience these horrendous traumas. And again, it's like the overdoses that they happen quietly. They happen, in bedrooms when no adults are looking. They happen in families. there is a hidden epidemic of trauma in our society that we don't like to talk about. And what happens, it comes out in our overdose statistics, it comes out in our mental health crisis, and it comes out in people who are coming to our injecting room, often 20 years down the track. They're ready to talk about it. They're ready to say, this is what happened to me, and I want to move on with my life. And the second thing that kind of stands out to me is how often they've been ready to move on with their lives for some time, and they find it difficult to know how to do that. I think it was lovely what was mentioned before, that kind of journey of healing that people need to take one way or the other, and how often, unfortunately, our health services, our social services, are not really ready to respond to people who've experienced trauma, people who are not good at organising themselves to attend appointments, who are not good at telling their story to people one after the other, to try and find the person who's actually going to kind of work with them over an ongoing period of time. And how much we need to do to alter many parts of our caring system to make them more trauma informed. There are, of course, kind of fantastic parts of it, but overall, we haven't really considered the needs of people who've been traumatized in developing our healthcare system. And yet we've seen so many people really, when they do find that, they are able to really kind of go on that journey of healing, as was mentioned by Stevie, and come out the other side. And that's been one of the other pleasures in this role, to see so many people do that. And I really do feel like it's been a privilege for me to kind of witness those. Of course, it's we're here partly to remember today those ones who don't make it, and that's I'd like to also kind of recognise that many of the people there are ones who we've known in that period who also haven't survived, and that there's as has been mentioned by others, there are a lot of things that we could do if we really wanted to reduce the toll of overdose in our community. We haven't pulled out all the stops. There are a lot of things we could do. But anyway, I just wanted to share a little bit about our experience of working in the injecting room in the last few years. It's certainly it's made an impression on me. It's been of how much, particularly we need to tell the story of how much hidden trauma there is in our society, and how we need to do something about that to prevent that trauma in the first place, and to kind of facilitate, acknowledge that it happens, to enable people to kind of come forward if it's happened to them, or if it's happened in their family or their communities, to prevent it happening to other people, and then to kind of find the best way to enable people to heal, so that less people feel the need to kind of numb that pain with substances in a way that at the moment is at risk for them overdosing quietly somewhere where no one's noticing. So thanks again for the opportunity to share that with you today, Peter.
Oh, thank you, Nico. And on behalf of everybody here and many Victorians and families, we'd like to acknowledge the wonderful work that you and your staff do at North Richmond. And you have our respect and our gratitude. And it's a privilege to work beside you. So thanks, Nico. It's with great pleasure now that I welcome Elissa Buggy to the screen. Now, what can I say about Elissa? Elissa is a bit of a legend in the court system. She was one of the instigators and establishers of the family drug court and of the drug court in this state. And she has worked tirelessly in the area of, what shall I say, harm reduction jurisprudence, and implementing sensible and humane policies around drugs and the impacts of drugs on individuals' lives in our justice system. Currently, she is the CEO or the executive officer of Flat Out Victoria, which is a peer-based program looking to support women within and leaving prison. Women who have been in custody, who are probably one of the most marginalised groups of human beings in this country, and many of whom are Indigenous, that Elissa's organisation works with. So it's with pleasure that I welcome you, Elissa.
Thanks so much, Peter, and thanks to the Yarra Drug and Health Forum for having me, and to Nick and Bernadette and the whole team. It's such a privilege to be part of this important conversation that happens, I mean, once a year and far too seldom, but it's nights like these that really raise the bar and raise awareness. And I thank you all so much for the dedicated work that you've done over so many years. I want to also, I am Elissa. I'm from Palawa country, that's we now know as Tasmania. I grew up down there, and that will, the relevance of that will come clear in a minute. But I also wanted to pay my respects to the elders, past, present, and emerging of the Wurundjeri lands that I'm now coming to you from, to acknowledge that these lands always were and always will be Aboriginal lands, and that sovereignty has never been ceded. And we're so privileged. I feel so honoured every day to plant and ground my feet on the beautiful grounds of one of the oldest continuing culture on this planet. The reason that I grew up in Palawa country is because Overdose Awareness Day always reminds me of the first and second funeral that I ever went to. In 2005, I sadly went to my one of my best mates' funerals, and although he didn't eventually die of overdose, he certainly battled many of them through the years that I knew him, and it was an extraordinary tragedy to have to turn up to his funeral. He was somebody who got 99. I'm not kidding, 99 out of 100 on his philosophy essay, which is just unheard of, and he was lost too soon. A brilliant mind gone. And the second funeral that I went to was in 2007, when I was working at a needle syringe program, a youth health service in Tassie in Hobart. And the young man that died then was only 5 years younger than me. And when Nico said just before that death by overdose is quiet and peaceful, he certainly, I hope, died peacefully. In fact, so peacefully that a 19-year-old in a crisis accommodation in the middle of a notorious hotel in the middle of Hobart town died so peacefully that for 3 days nobody even knew that he was gone. And I remember going to his funeral and looking around at the number of support people in that church, and it was just an extraordinary and striking realization that I had, that even the number of people that truly showed up for him, even after he'd passed, and overdose and the grip on him was so insidious that not that entire army of people could have intervened. And then I realized some years later that actually it was because we were missing the signs, and because of the stigma that was very much alive and well then, and unfortunately, as we've heard so often tonight from so many of our speakers, alive and well today. So I want to remember both of those beautiful young people who were lost too soon, and wanted to draw you 10 years into the future in 2017, when the Coroner's Court in Victoria looked at 220 of the 523 fatal overdoses The reason that the coroner at that point looked at those 220 was because they were specifically looking at the 220 overdose deaths caused by heroin. Of those 220 people that lost their lives to heroin overdose, 90 of them had a previous history of incarceration. 90, that's 40%. In fact, it's just over 40%. In our work at Flat Out, as Peter said, we work to support women, trans and gender diverse people who have been criminalised. That is, that they have a criminal history, many of them who have spent time in custody, spent time in prison, either on remand or serving a sentence. Those are the people also that Nico talked about, where trauma is found readily. And in our work at Flat Out, we despair at the number of missed opportunities to turn the figure around, because unfortunately it hasn't turned around. In fact, it's only gotten worse. At the number of criminalised people we support who are constantly being turned away from the help that they seek, or aren't able to find the support and information that might have avoided them from ending up as part of the next report from the coroner. As a community, we can avoid this tragedy. It is utterly avoidable. We can do this by introducing naloxone into prisons. We can do this by introducing needle syringe programs into our prisons. We can do this by providing timely and responsive assessments and entry points into ongoing treatment and education that recognises the whole person and sees beyond their criminal histories. By introducing true harm reduction policies that truly legitimise substance misuse for the health issue that it actually is, rather than criminalising it and creating another layer of unnecessary and unreasonable stigma and judgment. They're all attainable, humane and realistic goals that emphasise the collective community action over reductionist stigma and judgment. 523 people died of fatal overdose in 2017 in Victoria. At least 90 of those had histories of criminalisation, but they were also brothers, sisters, daughters and sons, as we've heard about so readily tonight. They're as much a part of our community as those of us who don't also have to endure the weight of criminalisation and carry it around like a figurative and sometimes literal ball and chain. We have to do better to avoid this utterly avoidable loss of life. The community I know is smart, it's passionate, it's compassionate, and it's one that brings me hope. When I hear about medically supervised injecting rooms, that brings me hope. When I hear the stories of Stevie Thorpe, of Cherie, and of so many other people, of Debbie, all the families, all of you out there who are so incredibly compassionate, passionate, smart, and brave, I know we can do it. And so I wanted to thank the Yarra Drug Health Forum profusely for giving all of us this opportunity to sit and reflect on the ways that we can and that we must do better to avoid this utterly avoidable tragedy. I want to end by remembering all of those, including my two dear friends who are unnecessarily gone too soon. Thanks so much.
Oh, thank you so much, Elissa. And yeah, I agree. There's a lot of hope and there's a lot of things that can be done, but we've got to keep on talking about it and keep on raising the issue. So I'm going to go to Mr. Denny Jeffcote now, who's, what can I say about Denny? I can say that Denny has been a harm reduction warrior for a long time. I first met Denny when he was working in Needle Exchange in Yarra many years ago. Denny is currently the manager of health and harm reduction services for CoHealth at Healthworks in Fitzroy. He worked for many years at Inner Space in Collingwood in the same sort of role for North Yarra Community Health and CoHealth. But then he's also a past, I think it's chairperson or president of Harm Reduction Victoria, and a long-time volunteer and contributor to the work and thinking around harm reduction in this state. So over to you, Danny, and thank you for being here tonight.
Well, thank you, Peter, and thank you for the warm introduction. I'd also like to pay my respect to the traditional owners of the land, who we're all standing on today, Aboriginal land that is and always will be theirs, and that sovereignty was never ceded. I also want to recognise my fellow presenters tonight. It's really hard to follow on from such moving stories, and yet I must, and it's important that we do. And after hearing those stories, the impact of stigma, the circle of stigma and trauma that flows through the conversations that we're having. That's what's the core of what compounds the issue for us. At its core, my job is to keep people alive and well, and that's something that that's a job I'm happy to do. Yet sometimes, for want of every best effort, someone doesn't make it. And when that happens, and when we do lose someone, that tragic loss of life, that tragic loss of potential, and the impact that has reverberates through our community. And it's the stigma that's associated with overdose death that really hampers healing for those affected. I'd also like to recognise that one of the reasons that Sally Finn originally brought this occasion together was to bring people together to be able to share their experiences of loss. And in this time of lockdown, as we are here in Melbourne, it's one of the things that we would normally, as a service, do, is bring people together, and something that we're not able to do right now. So I'm very grateful to the Yarra Drug and Health Forum for bringing this together in a virtual way. But I also want to recognise that there's lots of people who can't come together and share their experiences as they normally would on Overdose Awareness Day. Often it's those coming together at a service is often the only opportunity that some people get to really share their experience of loss. We heard John Ryan talk before about families saying that their loved one had died of something other than overdose, even suicide. Such is the stigma around their death, and the fear of that death being exposed for what it really was. What that also means is that quite often the friends of the person who's passed are not welcome at the funeral. And so they don't get to share with the family the important healing ritual of a funeral. And that's why it is important that we create opportunities for people to come together and share their experience of loss for those that they loved. So that's it is such an important issue because of the profound effects that we're talking about people's lives here, and every death is a preventable death. That's why this is such a heart-moving issue. Not only has someone lost their life, but it was a preventable death. And what can we do? Well, there's so much we can do. And it begins with a conversation. And if all we can do is, like we're doing here right now, is talking about it, being able to have a conversation with someone, anyone, by having that conversation, we create opportunities for discussion, for learning, for understanding each other's points of difference and commonality. It's through having the conversation that we will hopefully get to a point where we have less, and maybe eventually no deaths from preventable overdose, because these are tragically, deaths that don't need to happen. This is contested space. This is a difficult issue for a lot of people to talk about, and perhaps that's why the conversation doesn't happen. If this event has caused, is triggering for you and you're finding it emotionally difficult, please reach out to your supports. But please have the conversation. I'm going to keep it really short and sweet and just leave it on that, but please, let's keep the conversation going. Thank you.
And thank you too, Danny, to you for the work that you lead and for the work of your staff every day in helping and preventing overdose and bringing hope to people who often don't seem to feel like there is a lot of hope in their life. And I think one of the things that's come through these stories tonight is the impact of optimism and hope, and people being honest about the way things are rather than pretending or hoping for things to be different. So thanks, Danny. Thanks very much for that. Now, it's with great pleasure I invite Adam Wilson, who is a senior lawyer in charge of outreach. I think it's the outreach legal aid program for Fitzroy Legal Service. I hope I've got that right, Adam.
No, I haven't, Peter.
Oh,
No.
okay. I've got it wrong.
No,
I didn't
it's
have my
getting
notes. But I'll tell you how I know Adam. I met Adam when he was visiting services that I was involved in, providing free and timely legal advice to people who couldn't afford it. And these were young people with drug and alcohol issues. And Adam works for a service that has a strong history of taking law and its advice and its valuable advice to people who can't afford it and would normally not get it. And so Fitzroy Legal Service is a highly esteemed institution within the city of Yarra, and Adam is one of the worthy representatives of that organisation. So Adam also spends time working as a lawyer at the Injecting room in North Richmond, advocating and representing people around their legal matters before the courts of Victoria that use facilities like that. So welcome, Adam.
Thank you. Thank you. So yes, I'm the senior, the official title is Senior Drug Outreach Lawyer at Fitzroy Legal Service. And I work with people who use drugs, addressing their legal issues. As FLS, Fitzroy Legal Service has done as part of the program, which has been running for 20 years now, 21 years almost, I think, but for more than 50 years as an organisation. I'll start also by acknowledging and paying my respects to the Wurundjeri people, the traditional custodians of the land which I'm appearing, and pay my respects to the elders past and present. So I guess, International Overdose Day means so much to me, and I think it was the first time in this role that I actually stopped for a second and really stop and think about the impact just this silence that so many of the speakers have talked about has upon people, upon my clients that I've known and those friends that we'll miss, and such powerful words that have come today, and those that are still here. And also it's also a very strong reminder as to why we as an organisation, and myself as a lawyer and just an advocate in that space, do what we do. So in relation to those that we miss, I guess it doesn't come close to what Debbie and Cherie were talking about, and many others in relation to friends. But when a client's overdosed and consequently the worst outcome has occurred, it just like everything that you've worked towards just is shattered, it's ended. And you just realign what's actually most important. And it's all you wanted to do before was help them navigate this system that is, to quote Fiona, as someone have already quoted, fucking awful. But now that's gone. You can't, like they're complex issues. It doesn't matter anymore because they're gone. And you just have to stop. And the blunt instrument that is the legal system is no longer, you just, all you want to do is see their face, and see them smile again, and see that family member be restored in some way, but you can't. So on another note, I guess it's also for those that are still here. I mean, I remember the first time that someone told me while I was doing outreach in the injecting room that one of my clients had overdosed, and my initial response was just that sinking feeling that I was just describing before, only to see him coming out of the MSIR 20 minutes later, granted on a hospital bed, but he was talking, and he was telling me to see me in court next week. So, and I knew I was going to see him again and hear his quirky stories, and that is something that is a preventable death that is happening, and there's so much more that can be done, as everyone here has discussed. So it also reminds me this day why we continue to advocate for the legalization of drugs, or at the very least decriminalization. Why we fight against this obsession with over-policing, why changes to the bail law are being more focused on remanding the most vulnerable people in the community who use drugs, and just a basic human right to appropriate health services, and even simpler, a person's right to life, to just live. So in a nutshell, I guess, thank you everyone for what you've said. It stokes the fire within to help to continue to fight the good fight, to break that silence, and try to be heard in a very loud voice about this system, which is about fighting this system, which is still, as Chloe said, punitive and futile, and create what should be a big bang. I mean, we're so concerned about numbers every day. We're concerned about these numbers with COVID, but why aren't we, recording those numbers more about the amount of deaths we've had every year from overdose? Thank you.
Thanks very much, Adam. And you raised a really important point around human rights, and I think that's been talked around a bit tonight, but it's the one thing that's been absent in our conversation so far. Look, our next presentation is from Horace Wansbrough. Horace Wansbrough is a family therapist, youth worker, passionate harm reductionist that works in Bendigo and works within the prison system for different organisations. He works primarily as a family therapist and youth worker for YSAS, and works in the prison system in family therapy and with a drug and alcohol lens for VAADA. So it's over to you, Horace, and thanks for being with us tonight.
Hi there, my name's Horace. I'm a youth AOD outreach worker. It's humbling to join in solidarity with you for International Overdose Awareness Day and pay tribute to loved ones lost to overdose. On this day, I'm particularly drawn to memories of young people who've died too soon. Young people with talents in sport and music and art who've supported friends through tough times. Young people who've talked philosophy in cafes over a cup of coffee, who've brought a lot of joy to others with their humour and larrikin spirit. I feel saddened but also angry to think that most often they died alone, sometimes by accident, sometimes in a dark and pretty lonely place. Just this past week, our team supported a young teenager who was asked to do a supervised urine drug screen by his treating psychiatrist. I know that the local pathology lab have a pretty dim view of drug users and see people who use drugs as criminals. And I really couldn't bear the thought of this shy young man having to front up for that experience. It might seem like a small thing to have to piss in a cup to get your meds. But I thought, how much are we prepared as a community to risk the harm of exposing this young man to more stigma, more messages that you're dirty, that your health condition doesn't belong here, and that we can't treat you till you're clean. It's circumstances like these that push people underground, and it pushes them to those dark and lonely places. And that's where overdose happens. We can do better. Okay, thanks for that, Horace, and thanks for that presentation from that short video grab from Harm Reduction Victoria. It's now with great pleasure that I invite Judy Ryan to speak. Judy's pre-recorded this, and Judy Ryan is a resident in North Richmond, Abbotsford area that has been a long campaigner for a sensible drug policy and was a strong campaigner with Victoria Street Drug Solutions Group around the establishment of the Injecting room. And Judy's going to reflect on International Overdose Day from a perspective of someone who lives in the middle of the largest open drug market in Victoria.
My name's Judy Ryan, and I'm from Residents for Victoria Street Drug Solutions. And I'm really honoured to be part of the conversation today on this very important day, International Overdose Awareness Day. We started a campaign, a residents campaign in inner city Melbourne in 2016. And the focus was on the people that were overdosing and dying in our laneways and the stigma that was associated with those people. For decades, this had been an inner city problem, and there really didn't seem to be much happening in terms of addressing the health issue that it is. One of the extraordinary parts of the campaign that we ran was in 2017, we had a march down Victoria Street and a rally to campaign for a medically supervised injecting centre in that area, the second one in Australia. And people before us, long before us, had been being active about this sort of facility. So it wasn't a new voice, but it was a different voice. And on this day 4 years ago, on a very cold Melbourne day, we managed to get over 700 people walking down Victoria Street chanting 34, how many more? And that was the number of fatal overdoses that had happened in our part of the city of Yarra in 2016. And very mindful of the focus on destigmatising people with addiction and their families, we decided that the march would be headed up by people who had suffered the loss of a loved one from overdose. We approached people that had been very secretive about their loss and said to them, look, you'll be in safe hands, we'll look after you. And it was really amazing how many people stood up and said, yes, I want to speak about this. We decided that day that would be the focus of the march. We had a lot of politicians who were pretty keen to speak, but we made a decision that it would be a poly-free zone and that we would just give a platform to people that were suffering the stigma associated with not only the death of their loved one from overdose, but in fact, the dying, because leading up to an overdose death can be a very traumatising time for families. So, 4 years down the track, we still hear from people who were there that day who said it was amazing that a group of people across Melbourne would come together on such a controversial issue and make a difference. And I just want to read a couple of comments that were sent to me, and this has taken years for some people to be able to speak out about it. These were people who were there that day carrying photos of their loved ones. One woman wrote, "It was like being at a funeral. The feeling of loss and grief was palpable. We could publicly grieve without being judged. We related to each other's raw emotions. It was a good idea to exclude politicians from the formalities, giving due respect to the solemn occasion that it was and making it very authentic. It was cathartic. The collective grief of normal families marching sent a powerful message to the broader community. Thank you." The fact that we are still getting messages like this 4 years later is testimony to the fact that people are still coming to terms with the loss that they've suffered, but the empowerment they have now to talk about it. So I really support the efforts of groups like the Yarra Drug and Health Forum and many others who acknowledge this important day on our calendar. The more we talk about it, the more help will be sought. Families won't feel stigmatised and alone at this very difficult time. Thank you for the opportunity, and take care to all of you who are dealing with this sad issue at this time.
Welcome back, everybody. I'd like to really acknowledge the work that Judy Ryan and her fellow residents have done in supporting a sensible approach to dealing with drugs and drug issues within North Richmond, and their ongoing support for harm reduction and evidence-based policies. It's also now my great pleasure to introduce to you Steph Genettis from Harm Reduction Victoria. Now, Steph's prepared pre-recorded a presentation that looks at overdose and the impact of overdose across Victoria over the last 12 months. So it's with great pleasure that I invite Steph to the screen and to present this presentation.
Thank you for this invitation to make a presentation for International Overdose Awareness Day. I'd like to acknowledge the traditional custodians of the land that I'm joining you from, the Wurundjeri people, and pay my respects to elders past and present and any emerging leaders that may be joining us today. I'm going to be talking about 3 substance-specific overdoses that get less attention and are generally less well recognised compared to what I would argue is the most commonly recognised overdose, which is a opioid overdose. Often pop culture thinks about overdose in terms of people who inject opioids and that specific depressant overdose, but different kinds of depressants might present in a different way, and different kinds of substances, their overdose presents differently again as well. And then you've got polydrug use. So the kind of overdose that a person might experience depends on the drug that they're using, anything that's going on for them, that's their health, their well-being, all their biological factors, their psychological well-being, and the specific environment that they're in. So that would include factors like the temperature that they're in. So I'd like to look at GHB, MDMA, and LSD as 3 different substances that have 3 different kinds of common presentations if someone's experiencing an overdose. So just a working definition of what I mean when I say overdose, I'm essentially talking about anything that's more than what a person can handle. So that doesn't necessarily mean that the individual needs a medical intervention, that a medical emergency occurs. It might, but that's not necessarily essential criteria for something to be an overdose. So if we think about GHB, it's a depressant, just like opioids, like heroin. It's a depressant, but it is quite different. Essentially with GHB, you'll see on the slide, I've got a graph there that shows there's a really narrow dose range where a person is experiencing the desired effects. Now, a GHB experience might present similar to alcohol intoxication, but other features that are commonly associated with GHB use include increased sexual arousal. So a lot of people are using GHB in sort of sex party settings. Another feature that's really common is sweating or excessive sweating. And so that's something that's quite unique to GHB because it's a depressant where the central nervous system is slowing down, but a person, they're sweating more, which is something that you probably associate more often with a stimulant or an upper drug where a person is alert and active. So with GHB, it's really common for people to be using it in sort of group settings, either dance party settings or sex party settings, and having an absolutely great time. And then if they have just slightly more than what's the right dose for them in that moment, it might mean quite suddenly going into a state of unconsciousness, like not responsive to voice or even pain to prompts like that. And sometimes this might be understood as like a really serious medical emergency, but we have to recognize the history of this substance, that it was used as a medicine for people experiencing different kinds of sleep-related conditions. And what often is happening when a person has a bit more than what is the right dose for them, just slightly more, even if it's just 0.1 of a mil, they can go into like a deep or G sleep. And so it's really important. The most important thing if that happens is that a person's airway is not obstructed. Something that people report after experiencing a GHB overdose, which may require a medical intervention, which may require support, including ventilation to breathe. But people coming out of that experience often report feeling really, really great after having sort of a restorative sleep. And so understanding that can be quite important to understanding the GHB overdose. And one of the most important things in terms of harm reduction tips that we teach people is to be aware of the effective duration of the drug, making sure people are aware that even though you feel the effects, you're enjoying the effects for about an hour and a half, it's really having an effect on your body for about 3 hours. So making sure that you're not redosing too regularly. We recommend that people write down exactly what they had to the 0.1 of the mil, and they use like a slip barrel syringe to measure their dose, and then they take a note of the exact time that they have it. And if they are going to redose, that they use a timer. So that's GHB. Another substance that has a different kind of overdose presentation is MDMA. So MDMA is a stimulant. It is an empathogen. So it's like working with a person's serotonin as well as dopamine, and it is something that people might take to increase their sense of empathy and connectedness with other people. It makes music sound really good. It's something that people really enjoy because it makes it easier for them to open up, and that's why it is being researched as a potential psychotherapy aid, particularly for people who have post-traumatic stress disorder. But MDMA, its recreational use is connected with the dance party scene. Generally, it's talked about as kind of like a love drug. And people might be really enjoying the experience, the MDMA experience, or the ecstasy of that stimulant drug, and they might actually be overheating, or they might have had a dose that is slightly more than what the body can handle. And you have to be really aware of the risk of overheating with MDMA. So on a day where the temperature is about 25 degrees or hotter, or if you're in a confined space that's really humid and crowded, not that we have that opportunity to be all crowded together in sweaty gigs at the moment, there is a risk that a person might start to overheat, and then that process just can't be slowed down. So overheating is one of the things that people need to be really aware of when it comes to MDMA. Often people might be operating within sort of like a at-risk kind of space, but report that they're really loving the experience. So we're kind of like, particularly in Australia, I think we've become accustomed to taking a slightly higher dose than what produces the effects people are actually seeking. Somewhere between 70 and 120 micrograms is like about a normal dose, but people are often having doses that are greater than that. They might not have any kind of acute crisis, any kind of need for medical intervention, but there is still a risk when you're having those slightly larger doses of MDMA. Things to look for that people often like, but that's just normal. It's things like bruxism, like the gurning, that kind of typical presentation, muscle tension. Some people talk about the eye wobbles, the ocular clonus. They're all signs that you might be at risk of serotonin syndrome. Things are really serious if a person is presenting as confused and they're not actually able to speak coherently, because that's one of the things that MDMA does well. It makes it easier for people to connect and converse. So if a person is speaking in a confused way or they seem agitated, that's a clear sign that they're at risk of serotonin syndrome, so an MDMA overdose, and that they need to get medical support straight away, and if it needs to be made to cool that person down. Something else that's connected with MDMA, it's more common among women, and that is essentially when you might drink too much water and you don't have the electrolytes, so drowning essentially by drinking too much water. And something to be conscious of with MDMA is making sure that while you're active, you're having up to 500 mils of water every hour, but not more than that. And you need to be getting your salt intake. So the easiest way to do that is by eating. And if that's too hard, have a smoothie or have some soup. So yeah, just the final substance that I'd like to talk about in regards to overdose that people might not necessarily think of as something that you can overdose on, and that's LSD. So LSD is a psychedelic. It is known for its ability to alter thinking patterns and to give you a sense of interconnectedness to everything that is. And it has an active dose starts around 20 to 25 mics, so active in a really low dose range. And essentially anything above that can start to have quite pronounced effects in a person. It can really alter your sense of self and your relationship to the whole world, and that can be confronting. And so essentially not being comfortable with that experience could be more than what a person can handle. It could be an LSD overdose, and producing what's sometimes casually known as a bad trip, but in trip sitting practice is referred to as a challenging psychedelic experience. Something to be aware of with LSD as well is that it has reasonably neutral effects, like physical effects. So the risk of physical harm, experiencing physical harm from LSD, more often is associated with misadventure, like the environmental risks around you, getting yourself into a situation where you're at risk because of the environment, as opposed to the effects that are happening on your physical body. Something that is quite interesting with LSD as well is that you can have quite large doses until you get to a point where you essentially saturate the receptors that this drug is working on. And so sometimes people might be having a really difficult experience for a dose that's somewhere between 20 and 100 mics, because 100 mics is sort of thought of as like a standard dose, but it's a hard one to talk about. LSD is a hard one to think about dose ranges with. Then you might have people that have like an experience with a dose that's like over 1,000 mics, somewhere between 1,000 and 1,500 mics, and they actually report having an extreme sense of clarity and almost being able to understand exactly how everything in the world around them connects. And they might be able to present as, you know, really well grounded and have a do some really high skill things in that moment. So LSD and psychedelics in general, the effect that a person experiences and whether or not it's a challenging experience or what might be considered an overdose depends a lot on set and setting. So how well prepared is a person for that experience and what's going on in the environment around them. So really subtle things to do with the set, the person, and the environment can have an absolutely dramatic effect on an LSD experience. So essentially that's my summary of 3 different kinds of overdose, and I hope that you found that interesting, and my intention was just to spark a bit of curiosity about different ways of perceiving overdose, and just remember that for each substance, you need to do your specific research. And then when we're all talking about using anything from an unregulated market, you also just always need to be aware of the additional risks to do with not knowing that you're getting what you think that you're getting, because there's no quality assurance when you're using from an unregulated market. So do your research and practice harm reduction. Thank you.
Thank you very much, Steph, for your presentation. And thanks very much, Steph, too, for presenting, really raising the issue that overdose is not just about heroin and not just about opiates. And in fact, at the moment, we're seeing across Victoria and COVID situation, a preponderance of many, many other different sorts of drugs, illicit and licit drugs, being used by people through the stress of lockdown. So in conclusion tonight, I'd like to thank all our presenters and speakers. I've been deeply affected by what they've all had to say. I know those that are watching this also will have been. So on your behalf, I thank everybody that's taken the time and the effort to tell their stories, to give us their reflections, and really to point to the same issue that we've talked about for many, many years, that we need to stop the stigma, the shame, and the discrimination against people, families, and loved ones that are used and affected by the use of drugs in our society. I'd like to acknowledge too the work of Mr. Nick Wallace, doing all the technical support for this presentation, and for the work of the Executive Officer of the Yarra Drug and Health Forum, Ms. Bernadette Birchall. So on behalf of the Yarra Drug and Health Forum, stay safe. Please feel free to follow us on Twitter, Facebook, and other socials. Have a great night.